Hi everyone, Luke here with a quick head injury presentation. We'll start with what causes a head injury. So generally speaking, it's going to be some sort of fall, maybe a motor vehicle accident, sporting injury, or possibly even an assault. And I'm sure there's a few others there as well. Next point is a victim can sustain a significant head injury even without a loss of consciousness. So remember that age-old saying, I haven't been knocked out, so I should be okay. That's probably not true in some scenarios. Next point, anyone suffers a head injury should seek medical attention, and this is when they will generally get some sort of concussion assessment by their medical practitioner and possibly diagnosed with some level of concussion. Next point, always treat a head injury as a suspected spinal injury until proven otherwise. And on that point, remember the airway takes precedence over a spinal injury. So if you have someone with an altered level of consciousness, they're laying on their back, they've suffered a head injury, and they start vomiting, you have got to gently turn them on their side to make sure you clear that airway. Because if you do not clear the airway, the consequences are going to be much greater. Next one is a high-risk victim. So these are generally the people who will probably receive a CT scan in a hospital. So any sign of a skull fracture. So two that we'll look at today is raccoon eyes or battle sign. And these are signs of basal skull fractures. So you know how raccoons have those little black parts under their eyes? That's the first sign. This can appear hours or days after a head injury. And the second one is battle sign, which is behind the ears. Next point is any blood or fluid leaking from the ears or nose at the time of the injury. This is generally a sign that that's cerebral spinal fluid, and it's a sign of a fractured skull, generally speaking. Next point, amnesia before impact. So if you can't remember what happened more than 30 minutes ago, that's probably a bad sign. Multiple vomiting episodes, generally they look at more than 2 is serious. Age over 60 years and victims who are seizing under the influence of drugs or alcohol or neurologically impaired. So on the drugs and alcohol one, they don't know whether these symptoms are caused from the drugs or alcohol itself or from the head injury. The last one, neurologically impaired, that just means someone who is disoriented, their gait could be affected, so the way they're walking, or they could have some other factors as well. Last point, place any dislodged teeth back in place, but that is on the assumption that they're coherent and that it's a fairly minor head injury and they're able to put the tooth back into place, bite down some gauze to hold it still. If you don't believe they are capable of doing that in their current state, you should put it in milk, or if that's not available, maybe saline, so a tube of saline. Next one is the concussion recognition tool. So this is known as the CRT5, and this is made for community sports, school sports, that sort of thing, and it's designed for virtually anyone to use. So it's got 4 steps. So step 1 is known as red flags. So if you see one of these red flags, you call an ambulance immediately. I'll go through a few of them for you. So neck pain or tenderness, double vision, weakness or tingling in the arms or legs, severe or increasing headache, seizure or convulsion, loss of consciousness, deteriorating conscious state, vomiting, increasingly restless, agitated or combative. Next step, observe all signs. So these are things that you see which will most likely lead you to call an ambulance or at least get them further medical attention. So lying motionless on the playing surface, slow to get up, disorientation, blank or vacant look, balance, gait problems, so gait is walking, remember, or a facial injury after the head trauma. The next step is probably best to give them a printout of this document and say to the person, hey, can you please circle the symptoms that you're currently experiencing? I'll give you a few of them. So headache, blurred vision, pressure in the head, feeling like fog, difficulty remembering certain things. You could give them a series of numbers and say, hey, say those numbers in reverse. Things like that. Neck pain as well is another one there. Step 4 is memory assessment. So similar to what I was saying with the numbers there before, you can say things like, if you're at a sporting game, what venue are you at today, who won last week, who scored last in the game, and maybe what half are we in now. Then we're going to move on to post-head injury. So don't let the victim operate a motor vehicle. Don't leave them alone for the next 24 hours. You can use ice packs for swollen areas or painful areas which have taken that impact. Don't let them drink alcohol for at least 24 hours. You could use paracetamol, so Panadol, for mild headaches, but be careful not to mask too many symptoms. And probably the worst drug you give them is aspirin. Aspirin is an antiplatelet drug, so it stops or reduces platelet aggregation. If you look at it really basically, that's essentially thinning your blood. And if you're already bleeding, that's not a good thing to do. Last point is potentially if the person is discharged from hospital, they may get advice that they should get woken up every 3 hours. The main reason I put this in is, let's say an adult does not want to get medical attention. And if you live with that adult, every 3 hours you should wake them up that night and do an assess to see if they can walk and talk. So that way you're going to catch something, hopefully quick enough that you can get medical attention. Now down the bottom there is a good number to remember, so 13 Health. So 13 Health is an Australian number, and you will speak to generally a registered nurse and you can get advice on what to do next. That nurse may say this is an emergency and you need to call 000 here. Thanks, and I hope you enjoyed the presentation. I'll see you in the next video.